So we finished treating her, and I took the pillows away now. I had 2 pillows under her chest and 1 under her ankles. And so now I have to relocate the PSISs, or I could look for my hand mark on her skin. And now I'm on the upper sacrum. And I'm carefully moving, and I get a little bit of movement, I get a little bit of give. So I've taken up the slack, and now I can spring it. Can you see that movement? Okay. And now I'm going to come up to L5, and I can take up the slack, and I can get some spring mobility there as well. Let's have you lie on your back, and we'll see how the pelvis moves, how the ilium moves. So now I'm going to take up the slack, and I'm springing it, and it bounces back when I let go. It has improved somewhat. And let's see how the left side is. I can take up the slack, I can spring it, and when I let go, it bounces back. So that is improved. But what I'm especially interested in is in the response to the upper cervical spine. And so lift your head up, and I'm going to put this on the table, and then head down, and I'll put the Kleenex on your face. Good. And then we can film her face now. So I'm using traction the very same way I described before, and I can take up the slack now. And then I can spring it. Look at her feet bounce up and down every time I do it. So upper cervical mobility is much improved, and I believe that that primarily happens at the atlantoaxial joint, the first vertebrae on moving with the second vertebrae. And now I'm going to put your head back in extension, and we can take up your slack, and we can spring it. Okay, so I think we've made a difference, and so let's film away from her, and let's have you get up and walk around a little bit and just see how you feel. And if you give me feedback, speak loudly, because the camera doesn't have the best microphone. So yeah, just go down the hall and back. So had I treated the upper cervical spine, I would not have made a lasting effect, because the upper cervical was reflexively hyperextended at the upper cervical was hyperextended in response to the sacrum being hyperflexed. Okay, so with the sacrum stuck in flexion, the upper cervical compensated by being hyperextended. And so we brought the sacrum back into neutral, then the upper cervical was able to release. So this is a whole body approach, and it treats the bottom first. And the bottom cause was in the pelvis, not in the upper cervical spine. So give us some feedback.
I felt a little looser. I had a lot of things cracking as I walked. So my knee was cracking, and my ankle cracked, and I had some cracking in the hip area.
Uh-huh.
So
where do you feel looser?
Feel looser probably in my back.
Okay, in your low back.
Right there.
Okay. And move your neck around. Look up and down and side to side.
That feels pretty good.
Is there a difference in your neck?
It wasn't really tight or sore, so I don't feel a difference there.
Yeah.
I can't say that.
Very good.
This feels different, and as I walked, everything wanted to crack and kind of unloosen. So the cracking...
Loosen up.
Yeah,
wanted to loosen up.
Everything loosened up.
Yes, yeah. Yeah, very good. Okay, so this is a really interesting case where a restriction of sacral mobility and L5-S1 mobility caused a reflex hyperextension at the upper cervical spine, and that restoring movement in the pelvis caused the mobility in the upper cervical spine to be reflexively released. And again, I didn't even treat your neck. I didn't have to treat it.
The right has really good range of motion.
Uh-huh.
The left is slightly restricted. would be the only, but it's not sore, but it's like this can really go, and that's as far as I can go there.
Uh-huh.
But I didn't really do it before.
We didn't test it before.
So I don't know.
We didn't test it before. Well, I don't think there's a lot of YouTube videos showing this relationship of mobility in the pelvis and how it relates to the upper cervical spine. So I'm really happy to have this opportunity to post that information. So thank you very much.